Okay. So in today's video, we are going to um, talk about some real-time projects that you can add in your resume. For example, like you want to add a case study, or if you want to add some internship type of projects in your resume, this will be very helpful. And I'm going to give you like how a real-time application will work. And if you are in one of those projects as a BA, like what kind of user stories you will get, and what kind of like work you will do end to end, like what you will do. So first is let's take an example of this Zocdoc. Okay. So Zocdoc is nothing but this is a web application. This is integrated with even though this looks like a single application, like in the front end, right? So this looks like one like simple plain website or web application, but in the back end, this is being integrated with various healthcare systems. Like for example, here if you see, they say Zocdoc for health systems. If you want to partner with Zocdoc, okay, so these are the different hospitals. For example, Mount Sinai from New York, and we have different clients from all over the US, right? So Austin, Dallas, Houston, New York City, Brooklyn. So the customers are from different states and different parts of the US. You can actually partner with Zocdoc. Okay, so even though this looks like one single plain application, it's not. Okay, this is a in the back end. They are using a Zocdoc API, and multiple hospitals are getting integrated with this web application. So basically, this web application is one of the major healthcare applications in the US for booking appointments. Okay, so let's say what this will do. So if you have a condition called um, you want to see an let's say you want to see an eye doctor. Okay, so I want an eye doctor, and let's say I'm in Austin. Okay, I'm in Austin, Texas, and when I click on insurance career or plan, it's showing me one of some of the major insurances, like Aetna is very popular, BCBS, Cigna. So these are some of the major insurances. But if I don't have this insurance, for example, I am from a different insurance, I can switch on, I mean, click on this search. Then I can search for something called like maybe I'm just searching for Anthem. Okay. So in Anthem, let's say that I have this classic PPO plan. So I have this plan. Okay, so now I want some eye doctor who is in Texas, especially in the Austin area. Now I'm going to click on search. So it's asking me what type of care do you want? Do you want a routine eye exam? Do you have a specific eye problem? Or do you want to do some kind of surgery or something else? So I'm just clicking on routine eye exam. Now I click on continue. It's asking check my vision and eye health. Okay, now I want to continue. Now it is doing like a search, like within, if you see, it is doing within like 2 seconds. Okay, so performance level for this web application is very high. Within 2 seconds, it's showing me 11 in-network providers in the Austin area. And it is also showing me at the side, right? It is also showing me exactly in the Austin area who are those providers. Okay, so first I have a doctor called Kathy. Then I have Isabel. Then I have Dr. Guy, Isabel again, Melissa. So it's showing me different providers. So they are all eye doctors, and it is also showing whether they are out of network. They are in network with me or out of networks. Because for the plan, whatever I choose, remember I chose Anthem PPO plan. Okay. So for that particular plan, for insurance plan, only some of the doctors are in network. If you see here, it says that Kathy is in network, Isabel is in network, and then Guy is in network, and then Melissa is also in network. And after some searches, it is showing me even out of network doctors. Okay, so they're all in networks, 11 in networks, and 97 out of network providers. So out of network means they don't have a contract with my plan ID. So if I go here, I have to, maybe my copay is going to be different, or maybe out of pocket is going to be different. So there are going to be different charges. From as a patient, I'm going to have different charges. But if I'm going to go for in-network doctors, mostly I have to pay only the copay, and mostly all my services will be covered. Also, it is showing me like what is the like availability. So whether this Catty has something on Tuesday, so I'm going to click. It's asking on Tuesday 10:30 a.m. she has an appointment. So I'm going to click on show more availability. She has something on December 9th. So after 28th, like today, she's not having any more appointments for next 2 weeks. Then the next appointment is December 19. Okay. And then I'm going to click on 11:30 a.m. So it is asking me to uh, share email ID, uh, first name, last name, date of birth, and it's going to ask for some information. So, and then it's going to ask me to verify a few things, and then it's going to ask me to continue. So let's say that you are working for Zocdoc. Okay, so they hire you as a business analyst for Zocdoc. Now, what? And they are asking you, this is an existing application, and they are asking you to um, uh, now they're saying that we need to add more providers. Okay, so they're saying that there are going to be new doctors or new hospitals who wants to integrate with us. Okay, so list your practice on Zocdoc. So let's say that we they got a new market. Okay, let's say they got new market like Maryland. Okay, that's a new market for them. And in Maryland, they are going to partner with maybe 2 or 3 major hospitals, and they want to make sure all the doctors from those hospitals they need to get listed in this Zocdoc application. That is going to be your requirement. So the business owners are coming to you. They're saying that when they search for Maryland, so let's say that. Okay, so Maryland city, Maryland, and if I'm going to search, so okay, it's already showing me some kind of primary care doctors, but now we got new business with 2 or 3 hospitals. We need them to partner with us. Okay, so we, it's not only listing the doctors. Okay, there is something called integrating in the back end. So how are we going to we are going to make sure that all the doctors from that particular one hospital, they are integrated with Zocdoc, and how that, because they are an external application, right? This hospital is an external system. Now their database, their information is third party to our Zocdoc database. Okay, in the back end I'm talking about. So how are we going to integrate that? And how are we going to make sure, how are we going to make sure that their availability, if they change something, if this doctor is having some, suddenly she's getting a COVID fever on this particular day, maybe like tomorrow she wants to cancel all her appointments, or she's having a family emergency and she wants to cancel all her appointments. So she needs to log into her system or Zocdoc, and how she's going to like cancel all her appointments, right? So that synchronization needs to happen. So as a BA, first let's go one by one. First is you will be, so when we talk about user stories for these kind of requirements, first is you need to understand what is the market. Okay, first is who are the business owners, their names, that's very important. Okay, so you are getting okay, so who are their business owners and what are their names? You're getting first their names and their email ID. Okay, so your project owner is coming and telling you, we are having a brand new project that's coming up, and I want you to be the lead business analyst. So what do you do now? You get all the business owners' names, their email ID. You first schedule their first initial elicitation session. Okay, so you're going to schedule the elicitation session. Now, what you're going to do is basically about Zocdoc. Okay, if they don't have any kind of idea, because you are actually working for Zocdoc, right? So if they don't have any idea about what is Zocdoc in the back end, what kind of interaction is going to happen, you need to give them information. So you cannot be telling that I don't know about this, I have to discuss it with my developer. So those kind of because you have initial very first call, you're trying to build the trust with the business owners, because they are going to be, so business owners can be like anybody from that third party hospital. or new, like the project, whatever is coming to your IT team, right? So anybody from that third party vendors or third party that hospitals or doctors or anybody from that marketing team, anybody can come and talk to you because they think you are you are a professional, you are an expert, you know about Zocdoc everything. And so you need to have a very clear idea on how this Zocdoc operates on the front end and the back end. So you need to have a clear idea on the front end perspective. Front end means UI. UI means the whatever you see as a website, right? So that is a front end. So on the back end with the database connection or with the API connection, how is it working? So what kind of database we are going to use, what kind of navigation system you're going to use, and if you're going to use the API for calling all this from, we are going to integrate with multiple hospitals, what is the Zocdoc API that you're going to use? So basic, this technical information you need to gather from your developers. Okay, so front end, what is the navigation system, like how I showed you, you need to, maybe you can show a demo to them, this is what Zocdoc is, and then you can search with different specialties here. For example, you can see primary care, dentist, OBGYN, dermatologist, and then they can schedule appointments, they can cancel appointments, we don't have a cancellation fee. So all that, and what are the areas we are already integrated with. So you can give a basic idea, and then they, once they're well aware of how the front end usage is, now you need to gather requirements on what is your hospital and how many providers needs to be listed. First you're going to ask like number of providers. Okay, what are they, how many providers are there, what is their specialty, and then whether what are the different type of plan IDs. So when we say plan IDs, so remember we have multiple insurances here. We have Cigna, Aetna, and then we have
BCBS.
BCBS. Yeah. So give me 1 second. Is it getting recorded? Yeah. Okay. Let me record. I don't want to lose the data. Okay. So what are we going to tell them is like how many providers are there, and then what are the different insurance companies, and then how many plan IDs are available. So that plan ID information is very crucial. For example, I click here and then I'm going for Aetna. And then if you see here, I can see different plan IDs. So there can be thousands of plan IDs, especially when a new year is beginning. Like for example, from January 2024, each insurance will add multiple plan IDs and they may terminate multiple plan IDs. It could be in hundreds. Okay, so they're adding 100 plan IDs and they're removing maybe a 50 plan ID. So these are the common plan IDs. These will get updated very, very like regularly. These will get updated. It's not like one time thing. Okay, annually these plan IDs for every insurance they will get updated because the premium is going to change and some of the services may change. The doctors may be removed from that in-network plan. The contracting may they end. So and maybe sometimes government, right? They want to like change all the services that they're providing for the members. So there is going to a big state is losing their contract with Medicare, or maybe Texas is losing all their Medicaid like benefits. So because they don't have funding, and so they don't want to give this particular plan IDs to people. So they want to terminate those plan IDs. Accordingly, your plan IDs for that particular year, especially that annual year, right? So for the next upcoming year, there will be a massive change. So depending upon that, your system, so if you are working for Zocdoc, your backend system needs to have that this updated plan IDs. Okay. So what I'm telling is first you need to understand this terminology. So what are the different providers? What are their specialty, whether they are in network or out of network. So because not all doctors will be in network with all the plan ID. So for example, for with Anthem, with PPO, they may be in network. With HMO, they may not be. So with maybe with Blue Cross, with a particular plan ID, they are in network, and for a different plan ID, they are out of network. So you need to understand how many doctors are in network and out of network. So these in the very first elicitation call, you will discuss all this. And then how, like what kind of services, like um, once once this particular integration is happening, so what is the API? That's a very important one. What kind of API call? So what is API? API means Zocdoc will have a particular link. Okay, so they'll have a particular link, and this particular link, if you call this using this API, that external system can access our data. Okay, not all the information, maybe like some information. We'll restrict that, like whatever they can see. Okay, so maybe they can see documents if they want to upload, like insurance first name, I mean insurance photocopy. um, if a member wants to add a photocopy, okay, so insurance like first page and second page, they want to upload that, and from the doctor is logging in through their own web application. So like I said, maybe we can say Mount Sinai is an hospital, and Mount Sinai doctors are logging from their application. Okay, so they're logging in from their application, but they must be, that application needs to get integrated with Zocdoc, so that if they change in their application, something in they change in their application, it is changing automatically, getting changed in Zocdoc automatically. So if they're canceling some application, they need not log into Zocdoc. Okay, so they can just like log into Mount Sinai's application, and if they want to cancel the appointments, they cancel it, but it is getting updated in Zocdoc database. So in the backend, I'm talking about in backend how this integration is happening. So you need to know a little bit about in the backend, because the business owners will ask you, so should the doctors, everyone has to use Zocdoc, because we have to give training, because nobody knows about Zocdoc. So should we provide training to the whole hospital, everybody? Should we give them training, or how is it? Can they log into their own systems and cancel everything, and it will automatically gets updated in Zocdoc? How long it will take to get updated? Whether it will take 2 hours, or it's going to be real time, whether it's a batch process. So whether it's going to be within 2 hours it will get updated, or it's real time. They're going to ask this question. This is a very favorite question all the business owners will ask. If I change something in my application, how long it will take for Zocdoc database to get updated? Whether it's going to be real time, I change something, immediately it's getting reflected, or it's going to take 2 hours, or it's going to be every day batch processing, every day midnight that update is going to happen. So you need, as a business analyst, you need to know first is like how Zocdoc operates. Okay, if you're getting a job in here, you are an IT lead and business analyst, you need to know completely how this page navigates, and how, what kind of integration it is already having, what are the existing integrations, what kind of access every doctor will have. Now, front end, that is fine, it's very easy to understand, you can just show a demo. In the back end, right, how this Zocdoc database works, how that updation will happen, and then if someone suddenly becomes out of network, or someone gets, if the hospital terminates a doctor, a provider, let's say that suddenly a doctor is getting terminated by today, end of today someone is getting terminated, how long it will take for the system to get updated and send a notification to all the members saying that this provider is no longer with us, and we need to cancel all the appointments, right? So that's how you make this application user friendly. Otherwise, why someone is going to use a third party appointment application if they can have their own web application, own website, and members can directly log into any hospital and then schedule their appointment? There is some difficulty, right? That's why they're coming to Zocdoc, which is a third party application. So we have to like give them like how user friendly Zocdoc is, so how user friendly they are, and then now you need to get very specific requirements. So for very specific requirement means, like for Maryland, okay, so market is Maryland, and then I have one hospital called Mount Sinai. This is an example. I don't know whether Mount Sinai is, I know it's in New York, but I don't know whether it's in Maryland. So in Maryland, there is a hospital called Mount Sinai, and I'm going to give you 10 providers. Okay, so 10 providers, they are in network. Okay, in network providers, and these providers are eye doctors. Okay, let's say that their name, their profession, and also whether they're in network or out of network. So I said in network. So in network with certain plans, all this needs to be updated. This is going to be a user scenario, a very first user scenario for you. And then you need to create a user story. Okay. Now, can someone tell me like how to create a user story, and I can correct you? So this is your requirement, okay? So for Maryland business owners, okay, and there's a particular hospital called Mount Sinai, we have 10 providers. They are new providers. Their name needs to be listed here. Okay, they're all in network and they're all from eye doctors. Okay, so they're all eye doctors. So I'm going to create a user story for this scenario. How should I create it and give it to my developers?
Start. So
Yeah.
as I
Yes.
should be able to search for the provider Maryland and Mount Sinai providers.
Yeah, can you tell me
Yeah,
in that format
yeah.
of a user story as a
As a patient or customer, I don't know what to use over here. Please
as a
correct me.
member? Okay, as
Yeah.
a member,
As a member, I should be able to
I should be able to
search providers within Maryland,
search a provider.
in Mount Sinai providers, within Maryland,
Okay, for a Mount Sinai provider.
within Maryland,
Okay,
so that I can get a service from them.
so that I can book an appointment, right?
Yes, yes.
Book an
And
appointment.
within the acceptance criteria, I'm going to give like the providers should be in network for me.
Right. So let's go to the acceptance criteria. Okay, acceptance criteria is
So in this also we can either follow a format or without format also we can write down. Yeah.
okay.
And the providers should be
This
in
this
network.
user story is complete. Okay,
Yeah.
this user story is complete once. Yeah. What should happen now?
Once if I get a drop down of 10 providers within Mount Sinai.
Once all the like I'm going to list the providers. Okay, let's say that
Yeah.
once A to Z. Okay, I'm just giving you an example. A to
Z
Z. Okay, I'm just giving you an example. Don't take it seriously. So this user story is complete. Once A to Z, those providers names are all listed, right?
Yeah.
Names are available in Zocdoc UI,
Yeah.
right?
Yeah.
Okay.
And the
So
next, yeah.
yeah, then
And the next should be the providers should be uh, in 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 network providers.
so no acceptance criteria is like so what is acceptance criteria? This everything is like whatever you mentioned in user story, right? That needs to be
Yes.
completed.
Yes.
So they are available in Zocdoc UI so that the user can book an appointment, right? So in the description, maybe you have to give detailedly like the description you can provide all the providers names, okay? And
Yes.
then you have to make sure they are in network, okay? And then how this API integration is happening, okay?
Yeah.
At the back end, what the developers in because if you want to first our Zocdoc developers have to integrate with that hospital means both the party needs to do that integration testing. Okay, so our developers needs the Mount Sinai's API and also they need our API, right? So we have to do in the back end, right? Our developers have to do that connection. They have to do that in dev. They have to check in dev. So we need to test in dev environment, okay, whether that integration is happening. So what you do is you get 10 sample. I'll tell you how to test this. You get 10 sample providers name or you get real time also because you can just move that to prod. Okay, you get the real like 10 providers names. And what you're asking is you're asking our developer saying that these are the 10 providers name. They're all in network. Make sure in the database it's in network. And then please do that integration in the backend. And then I have to test. Okay, so we have to do that unit testing. We are going to make sure. So in the dev environment, when I log in dev environment, when I search here for Maryland, okay, so when I'm searching here for Maryland, so I said eye doctor, right? So I'm going to do eye doctor, then I'm going to search for Maryland, then I'm going to like search for Okay, let's say that classic PPO, and I'm going to search here. Okay, so now those 10 providers, right? They have their addresses also, whether they're in network with that particular plan, and then all that needs to pop up. All the 10 providers name needs to pop up. Also, based upon their address, in the right side, that map needs to pop up. Also, their availability. So all this can be test data. It's not real-time data. This can be test data. Now with this, so once you have done this unit testing, of course, your developer will do. You can also help him do. You can provide. You can also coordinate with the business owners and show them a demo in dev environment itself, so that they understand. Because if they're going to be new business owners, they may be expecting something different, and your navigation will be different, right? So for something very new, we can show in dev itself, like this is how it is it okay, do you want to change something? So you do your unit testing, and then you kind of show your demo in dev itself. Okay, you're not moving the code to QA. You're not moving your code to QA. Okay, so you are just showing this demo. And then if they have any kind of corrections, you can always tell your developers. Maybe they want, the business owners wants this to be, for example, it says heart loyal patients. So what is this? Why is this popping up? What does this mean? They want to add this particular item here. So we can discuss that with the developers, and accordingly we can change they can change the code. And once this development is complete, now we are moving the code to QA environment, from development to QA, right? So from dev to QA, we are moving the code. We means like developers will move. Okay, we are not doing anything. So once they are moving the code from dev to QA, now in QA, testers has to test. So not all in all the projects, especially in the US, not every team has this testing people. Okay, mostly business owners, business analysts only will be doing testing, that I will tell you. So you need to know how to test this in QA. So the code is already moved to QA. Now you will have QA login and everything, access and everything. So you log into the QA environment and test all the scenarios. So you need to create the test cases. So test cases means, for example, when I try to book the appointment here, if it's going to be a happy path, I'm choosing this Dr. Neeraj. I'm going to like click on Dr. Neeraj, what are the items that needs to show, and all the appointments needs to be whatever is available needs to be in yellow color. So maybe this is a business owner's preference, right? So if it needs to be in yellow, when I click, it needs to turn blue. That is a requirement. Now it has to ask for email ID, first name, last name. All this you have to create as a test case, right? So you have to create it. This is happy path. So they have a proper email ID, first name, last name, date of birth. Everything is correct. If I continue, I can book the appointment. Suppose something I'm giving you, like I'm
Wrong
giving you,
email format, then it
okay,
should
I'm
not
giving,
accept.
it should not accept. It's accepting, I don't know. So, but it should not, right? It needs to do some
No,
kind of,
only yeah.
oh, it's not, it is saying, right? Type a valid email ID.
Mhm.
I think it is showing, okay.
It is, it is.
Yeah, so this validation, right, it is not very easy. So this one you have to integrate. This our developer needs to fix this. This needs to be in a particular format, needs to be with particular characters, or how are we going to validate in the backend whether it's a valid email ID or not? Okay, so that our developer, you have to give those requirements to our developer, and then first name, last name, date of birth, and then whether it's male or female, and you want to continue and you want to book the appointment. So you will create the test cases. For QA, you need to definitely have test cases. Okay, you create a test case and also test plan. How long it will take for you to test all the scenarios for all the 10 providers. So we are going to test for all the 10 providers. So their names needs to pop up, right? So their names needs to pop up. All their calendars needs to be available. It needs to be in yellow. Whatever is available needs to be in yellow. When you click on that, it needs to turn to blue. And then you need to have a valid email ID, first name, last name, okay? And then date of birth. Then I want to know whether it's male or female. And then I continue, then I'm going to book an appointment. So this is going to be a test plan. And then for all the 10 providers, you're going to create scenarios, okay? Test cases and scenarios, happy path and negative.
Some things are mandatory and some things won't be mandatory. So even those test cases should be written.
Right. Yeah. Accordingly, you need to test. In QA, you will test. So why I'm asking you to understand how to create test cases, because I'm telling you, if you are on site, and because usually in India, like in most of the companies, we have something called testing team. But if you are on site, and if especially in the US, business analysts are required to test. Okay, we don't have, because of the funding issues and because of the resource issues and all that. BAs are paid very, very high, right? So they want you to completely understand like how to create a test plan, how to create a scenarios, and then how to test properly. You do thorough testing, and then if you find some defects, then you create a defect or a bug. Okay, you create a defect in Jira and assign it to your developers. You create a defect in Jira saying that even if I give invalid email ID, it's allowing me to log in. Okay, so that's a defect, right? So you created that defect, and then you ask your developers to fix that. Once he says that I have fixed it, now you can go and retest again. Again, you retest. And then once you finally are fine with all the scenarios, now the code is moved into UAT environment. Okay, UAT environment. Now you are giving all these test cases, and you're asking the business owners to test the scenarios. Okay, so now you are not testing, but you're giving all the test cases. Okay, so because they don't know, they are not IT people, they are not technical people. So you're giving this test plan, you're giving all the test cases, and you're asking that whoever is a primary business owner, you're asking that person to test all the scenarios. Mostly they don't know how to test. They'll ask you to show a demo how to test. So you can take one test case and ask, and you can also show them how to test this particular scenario. If everything is fine, then it needs to log in and book an appointment, and that scenario means it's a pass. So what is a fail or a pass? You're going to ask them to update that Excel sheet, and then if all the scenarios are a pass, then you can ask them to give a UAT sign off, right? All the scenarios needs to be passed. So even if one fails, if you're going to ask them to retest, and then once they provide sign off, only now the code is moving from UAT to production. Right. So once we are going to deploy, now we get final sign off, and then we are going to deploy to production. Production in the sense this will be available to public. Okay, so now public, like whoever is going to search in Zocdoc, members are going to find out this particular like 10 providers, whatever. So once we are going to move this into production, now you're going to coordinate with all this deployment team, because our developers will not deploy. So that you need to, they may ask in interview, have you worked with this deployment team, DevOps team, or this deployment coordination? Have you done that? Okay, so our developers will not move the code to production. Okay, it will be third party. Third party means inside Zocdoc itself, there will be a team called deployment team. So they only will do. So until UAT, our developers will handle the code. But after that, you have to like raise a request, and then you will ask them this particular development team to deploy the code maybe on a Friday night. Okay, Friday, maybe 9 p.m. EST. Okay, that's how deployment will happen, usually like late night or midnights or early mornings, because that time the system will be down and nobody will access the system. So something happens, you can revert back the code. Okay, so now you are planning for deployment, mostly you are coordinating. So you're raising that request, maybe the ticket raising and all that only BA can do. Developers, sometimes they do, sometimes they ask you to do, because you are the primary person who knows in and out of this requirement, right? So you may raise a request with the deployment team, and once you schedule everything for them, and then the code is deployed. Once the code is deployed, now we are going to do something called post-deployment validation. You will do. Okay, you can't ask the business owners to log in at 2 a.m. or 3 a.m. in the morning and do. So this is called as post-deployment validation. So if in the interview, if they ask, what have you done as a BA? Like, tell me your day-to-day activities. As what have you done? You need to tell all this. I was responsible for gathering the requirements, for writing all the user stories, for writing all the test cases, for the test plan. I was responsible for coordination during UAT sign off and also during deployment. And I also have done post-deployment validation. Post-deployment means this is in production now. Now I am taking some 10 providers. Already in the user stories, you will have those 10 providers. So now I'm doing in production, I'm doing validation. So you will have access in prod. So you're doing that, making sure everything pops up as per the requirements. And now you update in your user story. Okay. So in your Jira and your user story, you can take screenshots that this is working as expected. And then you close the user story. Got it? On Monday. So on Friday night, you do deployment, you check everything on a Saturday morning. On Monday, when you go back, you call the business owners and say that um, as expected, deployment was successful, and please see all the screenshots. And you can also validate and let us know if there are any problems. Okay. And then you have 1 month warranty. Okay. So during that warranty period, your team and you are responsible. If any kind of issue happen in production, your team is responsible to fix that without any cost. So something like that provider's name is not popping up, or they are not able to book the appointments, or some problem in production, some issue is happening. Usually every application, right, they'll have 1 month warranty. So you have to cooperate with the business owners, make sure all those fixes are done. So after 1 month, if it depends upon your project manager, you want to do it free of cost or you want to charge again. But 1 month, you're going to do it for free. So do you guys have any, are you getting a little bit of idea of like how a real-time application will work? Let me know if you can understand the process.
So yeah, from the users, like how many user stories we need to split this into, or in under the one single user story, we need to try to build from.
No. So if your sprint depends upon your sprint and your developers, right? So if you have a 2-week sprint, okay, you know what is sprint?
Yes.
Okay, so you have a 2-week sprint and they give you only 2 developers. So, and 2 weeks means like you have 10 days, say they, okay. And in 10 days, they have to code and you have 2 developers, and every day they can do only 1 point. So maybe each developer can take only 10 points. So you have only 20 story points available for them. If this particular user story is within like 20 points, fine, but usually it's not. Okay, so maybe this user story is 8-pointer user story. Only a developer can say whether it's going to be a 5-pointer or 8-pointer, how much of a dev effort it is going to take. Depending upon that, if it's going to take more than like 8 points, then you're going to split the user story.
Yeah.
So what is this 8 points and 10 points and all that?
1 point is for 1 day.
Oh, okay. 1 point is 1 day.
Yeah,
okay.
8 hours. Okay. So 1 point is 8 hours. So if this particular user story can be developed in 1 day, in 8 hours, then you give the 1 point to the user story. So if the business owner is saying that you can complete this within 2 weeks. Okay. Yes. So it depends upon what is your team's sprint time, right? So every team, even if you're working for the same organization, every team is going to have different sprint time. So it can be 2 weeks or 3 weeks or 4 weeks. Okay, 2 weeks, 3 weeks or 4 weeks. So if you're following like 2 week sprint, so meaning any user story has to be developed within that 2 week sprint. Otherwise, you're going to close this user story and create a new user story, and you're going to continue coding the next sprint. So you're going to ask the business owners how long you want this particular user story, whether you want to complete in 2 weeks or 3 weeks. Accordingly, we have to manage resources. So if it's going to be very critical project, you have to implement within like 2 weeks. Okay. Now what we do is maybe 2 developers are not enough, right? So you're asking the project manager saying that it's very critical, they want to complete within 2 weeks, 2 developers are not enough, so I want more developers. You can ask that, maybe they'll give you another resource. So you make sure that this particular user story is completed within 2 weeks. But if it is not very critical and you have some time span, or the business owners wants to complete it within 3 weeks or 4 weeks, then you can have like 1 or 2 developers. Then you can split the user story depending upon like how much level of dev effort it's going to take and testing effort it's going to take for them and also for you. Accordingly, you can split the user stories, and then you make sure within that 4 weeks all the dev work, all the testing, UAT, sign off, everything is completed. Can you understand the process, how one user
Yeah.
story needs to be
Yes.
split? It's not something that you create one user story, you carry it over. No. We need
So
to
we
make
will
sure.
be doing in collaboration with dev team while writing down the user stories to understand their story points.
So you create a user story, you put it in the backlog, and in the
Okay.
sprint grooming session or sprint planning, there's something called project review or sprint planning, right? Not sprint
Yeah.
planning, you have sprint
Trend
review.
refinement
Yeah,
meeting.
refinement or review meeting.
Yeah.
So you create like today you go into a call, you gather all the requirements, and when you have time, you create a user story in Jira. That's it. And then during the sprint review or call, right? That time all the team members will be there. So that time you can ask. Not it's not your job. It's a product owner's job.
Okay.
Okay, so creating and user stories with all the description acceptance criteria, that's fine. But giving points, because you don't know how long it's going to take for them to code. So product owner is the one who needs to, like, everybody will be there in the call. Okay, product owner will be there, scrum master will be there, you'll be there, developers, testers, everybody will be there in the call. And then we go to backlog, we take every user story, and then you're going to give your effort, like how much is going to take, whether it's one pointer from your perspective as a B, how long it will take to test this particular user story, and developer has to give from their perspective. We are not interfering here. We cannot say that no, complete this in 8 hours. We cannot say that to them.
Okay. So, in the elicitation meeting with the business owners, I should make sure that I have covered all the requirements till I get registered to the doctor, right?
Yes.
Okay.
So that once you create the user stories, you can give that link to them to verify. And if they want to add points, I mean, like add data into that, they can add. Yeah.
Okay.
You create a user story and you are like still confused whether I covered all the requirements. You can share that Jira ticket to them. And then
Okay.
if they want to add something in the description, they can add.
Okay. So that's not a one-time meeting that will going to happen. It's a recurring meeting till I make sure that I have completed everything, covered everything.
Right. You are the primary point of contact for this project. So that's why you are
Okay.
going to be a lead. No, developers will not join the elicitation calls.
Okay.
Unless it's going to be very specific technical discussion. For example, how to integrate our API with the third-party API. For that call, you can call the developers. But for the very initial meetings, you don't need any developers' help.
Okay. Got it. So in one of your session, can you show us like what type of questions, like how the elicitation will going to happen with the business owner, like the role play kind of thing? You, if possible, could you show us in a session?
Yeah, I can maybe tomorrow I can give you a
Yes.
session
Yeah.
on how to, like, you're asking me how, like,
Yes,
specific questions. Yeah,
elicitation. Yeah, I
specific
should,
questions.
or I as a BA should ask the business owners regarding the requirements, like how I need to ask, how I need to speak to you, like that.
Got it. Yeah, I can give you like specific. We have multiple techniques, but if you want like very specific techniques
Like
or
which
specific
role
questions,
majorly we use, like intro or the workshop session. In those sessions, how we're going to conduct the elicitations.
right. Yeah,
Right.
I got. Yeah, I can show that tomorrow for you
Yeah.
so that you'll get an idea. So I
Yeah.
just want to give you like, do you guys understand, like, if you will be working for one of the applications like this, right? Maybe Zocdoc or maybe any mobile application or member portal applications. So this is how it depends upon whatever team you're working. Okay, if you're working for any insurance company, you may be working for any authorization project. So these are some of the real-time projects. You may be working on claims project or authorization project or maybe appeals project. So this is a very famous one. So authorization is a very common project. All the insurance companies will have an authorization IT department. It's all completely automated. Most 90% it's automated. When a provider submits an authorization, right, through fax or phone, so they can do it 3 ways. They can do it through fax, or they can do it through member portal. Member portal in the sense I'm saying about website, that is member portal. So they can log in to member portal and they can use their account information. They can submit an authorization. So what is authorization? I have a dental procedure. I'm going to a dental doctor. The doctor says that my wisdom tooth needs to be removed. Now, my provider, my dentist has to submit an authorization request to my insurance and get that it approved in order for removal of that teeth, because it's not a very easy procedure. There are like various factors involved, so they have to like get this pre-authorization request and make sure that is approved before even they do the procedure. So usually these authorization forms can be done in like three varieties. One is like you can write down the form and fax it to the insurance, or you can call the customer care and you can ask them to like submit the authorization. You can give members first name, last name. This you are not doing, the provider is doing, or someone from reception, from front desk is doing this for you. And or the receptionist can like log into member portal and then give all your first name, last name, your insurance data and everything. They can submit the authorization. This is a real-time project. What I'm telling you is a real-time project. So there are three ways this authorization request is coming to an insurance company. So Cigna receives authorization like by these three ways. Now, how this automation happens? Once these authorization forms or requests are coming to Cigna's intake team, now we need to check for basic validation is first, and the system needs to check for first name, last name. Okay, this is automatic. Okay, nobody not there is no manual intervention. The system is doing it for you. So when something is submitted, first name, last name, date of birth, and then member ID. Without member ID, it's going to get rejected. Okay, member ID. So it will be asking for all this. Not asking, it will be like checking, doing validation for all these 4 elements. Once this is fine, then it is going to process everything into a queue. So in the queue, now there will be a person. So this like authorization approval person will be there. And then they will be able to view the request one by one, and they will be able to approve it. So this is one of the real-time projects. Like I'm telling how an authorization request gets submitted automatically, and from insurance point of view, how someone will log into that queue and approve it. So maybe I can discuss like tomorrow how to I mean, like talk to stakeholders during initial elicitation, and
Yeah.
then maybe I can take this one of these real-time projects like this authorization or claims or appeals, and then I can tell you on that.
So the project which you explained in the Zocdoc is which kind of project? Like what we can put for this?
This is like member portal.
Member portal. Okay.
Yeah, this is member portal. Something with the UI front end that like members are using, that is called as member portal. We don't say this as website because this is an application, right? Because this is integrating in the backend with different systems, and we have a database. So this is not something website. This is a member portal.
Okay.
Zocdoc is also available as mobile application, I think. So if you search in apps, if you see Zocdoc, I see here it's showing, right? It's available in Apple and Android. So it is also used as a mobile application. So there are
this is
two,
a desktop come mobile application.
right? So we say this as member portal. Whatever you see in desktop is called member portal system application, and whatever in phone we call it as mobile application.
Okay.
You got it? Little bit.
Yes.
I think you're getting a little bit of idea. Okay. Yeah, I hope this session was helpful. So maybe tomorrow we can discuss about this elicitation, like questions and how to talk to a stakeholder.
Yeah.
Okay. Thank you. Thank you everyone for joining.
Thank
Thank
you
you so
so much.
much.